I think it's time for me to clear some things up. And if you're a normal human who likes to get a massage or get tools worked on you, whether it's scraping, whether it's cupping, whether they're telling you they're breaking up scar tissue, or releasing knots, releasing trigger points, this video is for you. I'm Doc Jen, doctor of physical therapy, who used to believe a lot of these things as well, even when I graduated from physical therapy school, and I've had to update and change my mindset based on updated research. Because no, this isn't irrefutable, it's simply not true, and I'm gonna bring some studies to help back it up. Research shows that deforming just 1% of our fascia along our IT band is gonna take over 9,000 newtons per square centimeters of pressure and over 3,000 newtons per square centimeter of pressure to deform myofascia. I mean, we're talking about a steamroller on you. Research shows that the highest force a therapist has been able to show is 350 newtons. That's a little different from 9,000 and 3,000. And the redder the tissue gets from hands, tools, or cupping doesn't mean that we're releasing toxins or releasing more scar tissue. It literally just means we're getting some capillary wall leakage or rupture, which sure can help provide blood flow to the area temporarily, just like we see a temporary improvement in mobility and range of motion and a reduction in pain symptoms. But it's not because my hands or tools are mechanically breaking up anything, which isn't that great news? My butt's not going to suddenly melt away from sitting for long periods of time. My hip isn't going to go out of place from jumping on one leg aggressively. And although it doesn't feel good, I can get hit and thrown around, and my structures are still going to be intact because my body is more resilient, especially my fascia. I believe touch is highly valuable. Beyond improving local blood flow and lubricating the fascia through hyaluronic acid, I believe touch and manual techniques can be way more powerful based on the neuromodulation we create by reducing tissue tension and getting someone to feel better so that they can move into movements and not feel so fragile in their body. And it should be okay that it's not a direct mechanical effect from what my hands are providing, but it's more of an access point into the nervous system so that that person can start to feel better on their own. And that's an incredibly powerful tool that a manual therapist can provide along someone's pain journey. And if you want to dive deeper on what a trigger point, a knot, or some of these specific therapies are really doing on the body, this is exactly what my husband and I break down on the Optimal Body podcast, because as doctors of physical therapy, we want to dive into the research for you so that you better understand your body.